You know, some of the best stories in medicine are the ones that feel like a real-life detective case. We're talking about baffling puzzles that challenge doctors and leave patients desperate for answers. And today, we're diving into one of those mysteries, all based on a fascinating new paper by Kim and colleagues. It's about a rare and kind of terrifying condition that causes a person's shoulder to literally just self-destruct. So that's the big question, right? How does a shoulder that seems perfectly healthy one day suddenly start to collapse on itself, sometimes in just a few months? For a long time, the cause was a total black box, which made it incredibly hard for doctors to catch it, let alone treat it effectively.
And when I say collapse, I really mean it. Just look at this X-ray. You can see the socket, but where the ball of the shoulder joint is supposed to be, well, it's pretty much gone. This isn't your slow, gradual wear and tear from a lifetime of use. No, this is an aggressive, shockingly fast destruction that leaves a person in severe pain with an arm they can barely use.
To really get how doctors crack this case, we first have to meet the villain of our story. We need to put a name to this condition. Okay, so the official name is rapidly progressive destructive arthrosis, or just RPDA for short. And the key words here are right in the name: rapidly and for a long time without a clear cause. This isn't your grandma's arthritis. It's more like a runaway train of joint destruction. And for years, doctors didn't really have a map to spot it before the train had already gone off the rails. So who gets this awful condition? Well, the first big clues were hiding in plain sight, right in the patient data. And what they found pointed to a very, very specific group of people. Get this. In the study we're looking at, every single one of the 19 patients who ended up needing surgery for RPDA was female. 100%. That is a pattern so strong you just can't ignore it. It was the first huge clue for the researchers.
And what about age? Well, the average was nearly 74 years old. So a clear picture starts to form, right? This is a condition that almost exclusively targets elderly women. And that demographic profile is a massive piece of this diagnostic puzzle. But here's the catch, and it's a big one. In the beginning, RPDA is a master of disguise. A patient just comes in with some shoulder pain. The initial checkup might point to something really common, like a simple rotator cuff tear or a little bit of arthritis. The true destructive monster hiding underneath stays completely hidden, and that's exactly why a new way of seeing it was so desperately needed. And this is where we get to the breakthrough. The researchers created a 3-stage system using advanced imaging that finally gives doctors a roadmap, a way to see RPDA for what it really is, even when it's trying its best to hide.
Okay, look at this. This slide shows you exactly why this was so hard to catch. On the left, you've got a standard X-ray of a patient in stage 1. Looks totally normal, right? You'd send them home with some physical therapy. But now look at the MRI on the right. See that bright white area inside the ball of the shoulder? That's fluid swelling deep inside the bone. It's called bone marrow edema. It's the very first whisper of the coming storm, and you can only see it with an MRI. All right, now we move to stage 2, and the damage is no longer hiding. On the X-ray on the left, you can now physically see that the top of that bone is starting to flatten out. It's collapsing. The MRI on the right just confirms the bad news, showing the damage is even more widespread. The joint is starting to fail. By stage 3, we're in a full-blown crisis. The X-ray on the left is shocking. The head of the bone has collapsed by more than half. And the MRI shows the devastating collateral damage. The rotator cuff, the group of tendons that holds your shoulder together, it's completely gone, just absent. At this point, the joint is barely hanging on. So this table kind of puts it all together for us. Stage 1 starts with that hidden swelling you can only see on an MRI, while the rotator cuff is still mostly okay. Stage 2, you get a partial collapse, and the tendons start to tear. And stage 3 ends with that massive collapse and a rotator cuff that's just gone. It's a clear, predictable path of destruction, but only if you know what you're looking for. So, if a shoulder can literally destroy itself, is there any way to build it back? Well, thankfully, the answer is a resounding yes. And that brings us to the surgical fix.
This is what a surgeon is looking at when they operate on a late-stage RPDA shoulder. I mean, there's not really a recognizable ball left for the ball and socket joint. It's just a landscape of destroyed bone. It's a huge challenge to reconstruct something from this.
And here is the incredible solution. Surgeons can go in and perform what's called a shoulder arthroplasty, basically a shoulder replacement. For these cases, they often use a special kind called a reverse total shoulder replacement. It's cleverly designed to work even if you don't have a rotator cuff anymore.
They basically take out the destroyed parts and put in a brand new artificial joint. And do they work? Oh yeah, the results are nothing short of life-changing. This chart shows a functional score, which is just a way of measuring a patient's pain and how well they can do daily activities. Before surgery, the average score was a dismal 26.5 out of 100. But after surgery, it rockets up to 75.1. That's the difference between not being able to lift your arm to get a glass from the cupboard and getting your life back.
So, after all of this, we get to the single most important lesson from this whole medical mystery. And it's simple. Timing is everything. Here's the thing. While the surgery works wonders at any stage, the study proved that patients who were diagnosed and treated early, back in stage 1 or 2, had much better outcomes than the ones who waited until stage 3. It makes sense, right? The longer the disease rages on, the more damage there is to fix, which makes the surgery harder and the recovery tougher. And the researchers themselves put it perfectly. They say the shoulder replacement needs to happen before all that severe bone loss and collapse really sets in. So this whole staging system isn't just for a medical textbook. It's a call to action. It's a tool to help doctors diagnose this early and give patients the best possible shot at a great outcome. And that leaves us with a pretty wild thought, doesn't it? This whole devastating disease hid for years behind what looked like a perfectly normal X-ray. It really makes you wonder, what other medical mysteries are out there, just hiding in plain sight, waiting for us to look at the human body with a new, more powerful lens?